This is Dr. Sharon Levine. I'm the section head for geriatric medicine in the Division of Palliative Care and Geriatric Medicine here at MGH. And welcome, everybody. Spring is in the air, I promise, even though it's 43 degrees outside as we speak. Yesterday it was 72, and the daffodils are out and the forsythias are out. So I know spring is really here. And we are all feeling a little more optimistic every day. And this is a good time to ask the question, can I really travel and hug my grandchildren? And so we're going to allow our panelists to talk to you about that. Dr. Sanchez will address that, and then Dr. Russell will give updates from senior health. And, you know, put your questions in the chat and we'll get to all of them. But it's great to see everybody. I have to tell you, it's just, I love seeing your faces. It really makes my heart go pitter pat. So here we go. I'm passing it on to you, Dr. Sanchez.
Hi, good afternoon, everyone. It is also so lovely to see everyone. I'm Dr. Sanchez. I'm an infectious disease clinician, and I also serve as the Infectious Disease Bureau Director for the Boston Public Health Commission. And it is always my joy to just come here and talk to everyone about, you know, what are the things that matter most to you and what are your concerns and your questions and how can we really meet those? And so I'll start off by just offering, I also sort of share and echo Dr. Levine's glimmer of hope as we approach spring and as we have many important tools in our arsenal now, including our COVID-19 vaccines. And so last Monday, we opened up eligibility to the general public above the ages of 16, which is incredibly exciting and just such a milestone for us in the field. I know a lot of claps in the field of public health. And so, you know, if you have family members, you know, loved ones, please encourage them as they desire to get vaccinated, as they all can now. You know, that brings us to sort of general points around some of the questions that you all had raised. Right now, you know, there are several vaccines that have been authorized by the FDA under emergency use. The two that are currently in current use are the Pfizer and Moderna vaccines. Some of the questions that you all submitted were regarding the J&J vaccine and, you know, what's exactly happening with that. And so I wanted to just pause a little bit and talk about that. So as you all know, this is one of the most extensive vaccine rollouts in history, and also one of the more closely monitored vaccine rollouts in our time. And so last week, the CDC and the US FDA recommended a pause on the J&J coronavirus vaccine following 6 reported US cases of a rare and severe type of blood clot. As of last week, there were more than 6.8 million people that had received the J&J vaccine. However, given the severity and given the need for more information to investigate this side effect and to give clinicians guidance as to what actions to take, the CDC and FDA decided to make a pause. You know, all of these cases occurred in women between the ages of 18 and 48 and occurred around 6 to 13 days after vaccine. And, you know, we're still awaiting more information. You know, part of this is that we'll await more, you know, to see if there are more and more cases that are going to be announced, or, you know, the CDC and FDA are taking the time to determine, you know, what really are the risks and how we should best proceed. And so in our surveillance system, I mean, you know, we are really able to detect even these rarest side effects and take action. And so we will keep you all posted as we unfold more. And so with regards to vaccination, one of the more common questions, and I know that many of you have, is I'm fully vaccinated. What can I do? And, you know, a useful analogy that I've developed lately and used is thinking of the vaccine as kind of a winter coat. You know, for the most part, our winter coats are really strong and bulky and effective, and they'll keep us warm and protect us against even the most chilly weather. However, when it gets really cold out, like some of the winters here in New England, you'll often find that the strongest coat is not always enough and that you'll need to add on more and more layers to better protect you. The COVID vaccines are a very strong coat. They are very effective at protecting us from COVID-19 infection and disease. However, you know, I think some of the guidance can still be confusing to people partly because depending on the risk of the activity that we want to pursue, or the people around us, or the level of virus circulating in our communities, it's possible that we might still need some of those layers, that we might still need to wear a scarf in the winter, when it's really, really cold out, or wear a hat. And so thinking through what some of that means, one of the most important layers of protection around us is when other people around us are vaccinated. That really, really, really enhances the level of protection. And when we are around people that are all vaccinated, it is very unlikely that we would be able to, to transmit or contract COVID-19 virus. And so that's the CDC guidance related to being able to be to being able to be indoors without masks and hugs and all of that, which is really exciting and really needed. Now, another piece of this is that, and so that's one of the latest sort of CDC updates. The CDC posted some guidance as to being indoors with unvaccinated individuals as well, and sort of what to do. And that's another common question that we get. And that pertains to a lot of you who have grandkids who are still not really able to get vaccinated. And so, what the CDC says is that as long as, we really keep it to a small number of people, ideally one household, and as long as other unvaccinated people around when we're inside, let's say you're with your grandchild, your children, and it's one household and only that grandchild is unvaccinated, it should be a pretty low risk. And so again, that's part of thinking through now how the vaccines can help us resume some of the activities that we really miss and cherish. That being said, a lot of this is, and this is another part where I sometimes use analogies, a lot of it really depends on what we're comfortable with. And so, I think it's one thing to note that we can be indoors, or the CDC says that we can be indoors, with people who are with, a small household who's unvaccinated. But, I think it's all up to all of us to determine how comfortable we feel with that. And I think that's a piece of effective, but they're not perfect. And so I think a lot of this is really going to be, thinking about what matters to us the most, and what we really want in these next few months. The CDC does still caution against, for example, medium, large gatherings, or sort of, going to, because those do still present a risk of potential transmission. Again, the more risk around us, the more we might need those extra layers, like other vaccinated people around us, masks, testing, and all of those tools that we still have at our disposal. And so with regards to the variants, I know that's another common question. Now, I would say that a lot of the preliminary evidence up to date suggests that the currently authorized COVID vaccines will provide some protection against our variants. The one that's most currently circulating in the United States is the B.1.1.7 variant identified in the UK. And that one, most vaccines should provide a very strong protection against it. That's actually pretty encouraging. Some of the other variants, like the B.1.351 from South Africa, or the P1 variant originally identified in Brazil, there are still emerging studies trying to figure out how protected we will be. For the most part, it seems like the vaccines will offer some protection, but that we're still trying to determine how much of that protection is enough. And so a lot of this is emerging every day. And I think that pertains to, again, bringing back a lot of the questions around travel, which again is another question that we get quite often. And so a few weeks ago, the CDC revised their guidance to say that fully vaccinated travelers are less likely to get and spread COVID-19 and can now travel at low risk to themselves domestically. They do make the caveat that international travelers really do need to pay close attention to their situation in the country that they are traveling, in the destination, because again, thinking back about the coat and the need for layers, there's more virus circulating in those communities, or if there's more unvaccinated people around you and in your flight, you'll have a little bit, your layers of protection will be a little bit less. Again, the vaccine will protect you quite strongly, but it's not perfect. And so I think, I have my own grandmother is traveling in a month to a graduation. I've told her, you still need to wear a mask in the airplane. You still need to keep your distance. You still need to, she's traveling because it means a lot to her. And I'm very excited that she is going to pursue that opportunity because she hasn't traveled in over 2 years. And that's really hard on all of us. But she is still taking her precautions and picking and choosing, again, activities based on what they mean the most to her. Like, for example, she's probably going to hug me. I'm fully vaccinated. That's a pretty low risk. She might hug my cousin. My cousin's still not fully vaccinated because she wasn't eligible before. But again, all of this is, what really matters to you. But again, taking some of those measures when it comes to some of the risks. With the travels, the CDC does recommend getting tested when you return from international travel still. And so that's a little bit of a piece there. And so I think that's like a very rough level overview. I think this is very encouraging. I mean, I think being fully vaccinated, and I'll remind everyone, being fully vaccinated means 2 weeks have elapsed from your second dose of Moderna and Pfizer, or if you receive J&J, 2 doses from the J&J. And so that's another thing to keep in mind when you're figuring out who you're going to see, are they fully vaccinated, are they not? But I think the low level sort of summary is it's pretty safe to be around other people who are fully vaccinated. With people who are not, I think it just depends on, the level of risk of the activity and what you choose to do and how, their own risk of severe disease. And again, on what really matters the most to you and your loved ones. And, we hope that as more and more people get vaccinated, those layers of protection, right, will increase, that we'll be able to enjoy even more of the activities that we look forward to. And I think I'll stop there and sort of look to the chat to see if other people have questions.
I put into the chat the current CDC guidelines for
Thank you, Dr.
vaccinated
Levine.
people as of April 2nd. I know it says 2019, but they've been continuously updated. These are the most recent I see. Sorry, do you agree with that?
I believe April 2nd, yes. And I was
Yeah.
actually going to put an infographic that I was going to pull up, but I can sort of share. It's a picture that has like a little checklist of all of the summaries on the things that, we can and can't do and what we should, still sort of be a little bit careful about.
I think you just sent that just to me, Dr. Sanchez. You want to send it to the group. Sorry.
Oops. My technology savvy.
No worries. While we have you, there was the New England Journal article that came out yesterday that talked about people fully vaccinated coming down with coronavirus. And I was wondering if you can speak to that in terms of how severely we should be worried about that. And also, how sick did these people actually get? I mean, is it the same as just never having been vaccinated?
Yeah, and so I think in that study, they had found that around 2 people in a cohort of like 461, I believe was the number, had a breakthrough infection, meaning that despite being fully vaccinated, they had still gotten sick and experienced some symptoms of COVID. Now, from the symptoms, I don't recall that they mentioned.
Sorry, this is Judy. You're cutting in and out a little. So I'm not sure if there's something you can do to change that, or talk just a little slower so maybe the words will all get it. Mostly you're there. Okay. So give us a try again and answer the question. Thank you so much.
Sure. So the article that we're talking about was one that came out yesterday that was looking at a cohort of around 460 patients who had been fully vaccinated. And out of those 461, 2 of them had contracted a coronavirus infection. Now, from what the article says, they did experience symptoms, although I do not recall that they were symptoms of severe disease. 2 out of 461 is still a fairly low it's still a fairly low rate, right? When we think about 95% efficacy, 94%, that there is sort of that rate. And so it's actually, I found it to be, somewhat encouraging. We are still looking at a public health level and trying to figure out what are the rates of breakthrough that we are seeing. What I will say is that the most likely, part of the risk of breakthrough infections relates to the fact that we are still not all of us are fully vaccinated, and that we are still, there are people who are interacting with people who are still not fully protected. And that, again, that sort of decreases the strongest protection protection that we get from vaccines is not only on us, but when everyone around us has that, I think that's an important piece here. And I think that's why we still have to take some precautions, especially as it pertains to being in the public and as we move beyond interacting with those amongst our immediate bubble. And so.
Thank you.
Any other questions that people have or want to put into the chat? Talk about the variants.
Sure. So, I think briefly, they're the most common circulating variant, both here in the state of Massachusetts and in the United States, is the B.1.1.7 variant. That was the one that was originally identified in the UK. That is, is believed to be slightly more transmissible as well. And there's still sort of uncertainty as to whether or not it carries, there's conflicting evidence around the severity of disease. We believe that our COVID-19 vaccines do protect against this variant. So again, that's why it really underscores that we really need to, as we sort of push out vaccination, we're hoping that it will really halt and dramatically drop transmission. Other variants are the P1351 South African variant, and that one was originally identified in South Africa. That one and the Brazil original P1 variant originally identified in Brazil. There have been studies that have measured antibody responses in the blood that have seen slightly lower levels of immunity and protection. Now, what that means in real life, we still don't fully know. And I think that's an important piece of this, is that it does seem that they will offer some protection, but we really just need to know more real world studies to really determine this. And so I think that's really what we're still waiting on. There's still data coming in, new data coming in every day, but a lot of this will sort of unfold. And a big important part of this too is that our vaccines, this is quite common in viruses. They mutate, and so our vaccines, oftentimes we have been reckoned to provide booster shots, think through what are the ways that we can get around this. And so again, I do have hope that we just have to get everyone vaccinated as quickly as possible and take time to figure this out.
Thanks so much, Dr. Sanchez. It's really great to have you be one of us and to now be at the state level. We're very proud of you that you're in this role, and we've loved having you on our town halls. I want to move now to Matt Russell. Dr. Matt Russell is the medical director of senior health and of the section of geriatric medicine also at Mass General Hospital. And he's going to give you some updates around senior health and COVID and senior health in general. On to you, Matt.
Thank you, Sharon. First of all, thank you, Dr. Sanchez, for taking the time out. This is from your new gig. We are so thrilled that you are doing great things for the city of Boston. Thank you for the updates and that valuable information. I have just some updates for our senior health practice patients. So first of all, as with everything related to COVID, please make sure that you have received your vaccine. And at this point, all of our patients in our practice should have received them, unless they've sort of chosen not to, or there are other special circumstances. If you are a senior health patient and you have had trouble, please call us and let us know, because at this time we expect that the overwhelming number of our patients have been vaccinated. The second thing I will say, and I'm bringing this up at every meeting until it happens, we will eventually be moving our offices from Charles River Plaza to the Yawkey building at the main campus of the hospital. We'll be located on the second floor of the Yawkey building. The date of this move is still very up in the air. I was told sometime between May and September of 2027. So if that should give you a good ballpark. I have no idea when we're moving, but I'm hoping it's going to be sometime in the next few months. Other offices and clinics have to move first in order for us to then, it's a sort of a domino move. So we just have to wait our turn. So we're looking very much forward to this relocation. It brings us closer to other specialties. There's valet parking, and it allows us to just pop out of our office and go see a patient if they happen to be admitted. So it just makes things a lot tighter for the geriatrics practice, and we're really excited about that. So what can you expect? Once we get the date of the move, we will be sending out a blast either through an email or a patient gateway. We haven't been given permission one way or the other, but just basically saying, as of such and such date, we will be relocating. Moving forward, if you have an appointment on this date or beyond, go to Yawkey 2. We're also going to have our front desk staff incorporate that in their day before visit to say, as a reminder, we've moved to such and such to the Yawkey building. But right now, it's business as usual. We're in Charles River Plaza. Next topic is something we're really excited about, and that is our group visit program. So one of our geriatricians, Dr. Deborah Lee, has been piloting over the past few months a virtual group visit model. And a group visit is one in which the physician meets with a group of patients, a small group of patients, to present some educational material in a group. And then at the end of that time, the doctor will then go on to meet privately with each of those patients in a separate encounter. So say it'd be like a Friday afternoon, Dr. Lee comes, you listen to her speak about something. She's been doing bone health, where she's been talking about things you can do to keep your bones strong and how to prevent falls and stuff like that. So a little educational material. And then after that, she hangs up and then she'll talk to each individual patient either by telephone or with a Zoom call. So we are going to probably continue the bone health one, and we're going to be sending out sign up email notifications for that. This is covered by your insurance as well, which is great. Later in the spring or early summer, our next group visit is going to be focusing on the Matters Most conversation. So this will be inviting our folks in senior health to sign up for an educational workshop around planning for your care, and in moving forward if you get a serious illness. So for example, this will focus on how patients make sure that their wishes are known and implemented by a trusted proxy decision maker if you're not able to speak for yourself. So remember, as long as you're able to talk for yourself, you rule the roost. But if you're not able to speak, if you have a health crisis, you want to make sure that someone is speaking for you. So the first part of this will be an educational module where we'll go into that. And then you will have the option to do a group visit at a later date, probably with Dr. Lee and or me and or Emily, our social worker. So stay tuned for that information. And then over the course of the next couple of years, we're probably going to find other topics that will be of interest. So say, for example, something around diet management, eating well for aging, best fitness things, where there's an educational component and then there's an individual opportunity to speak about your unique concerns. So we're very excited, so please stay tuned. The next thing I just want to talk about is our virtual visits. So we did send out an email to our patients in senior health, and it just is something that we have to unfortunately keep saying. As of April 1st, the virtual visits across state lines where we were able to pop in by video if you happen to be in New Hampshire or if you happen to be in Florida, we found that wonderful during COVID. Well, that was very much allowed during the public health emergency related to COVID. But as of April 1st, the state regulations are going back in place. So we are not able to practice medicine outside of the state of Massachusetts in virtual visits. So what that means is if you happen to be in Massachusetts and your summer place is down in the Cape or out in the Berkshires, you're good. You're within the state of Massachusetts. We could see you virtually, or if you want to schlep into Boston, you're welcome to schlep into Boston. But if you're going to be outside of Massachusetts, we can't do a video visit with you. So I hope that makes some sense, and feel free to ask questions about that. Obviously, we're open to see people for in-person visits, and we're starting to do more of those. Many of our patients are saying, well, I'd actually like to do a virtual if possible. And right now that's fine. We are working on finding the right balance. Certainly if things require an exam or blood work, we tend to say, we really need to see you to come into the office. But if it's just sort of a blood pressure review and we're just going over things that we could talk about, usually we can do a virtual visit. All right, the last thing is we'll be announcing our May town hall date in the next week or so, and we're working on some new exciting, believe it or not, non-COVID topics. It's so wonderful to be thinking maybe we won't have to talk about COVID, incessantly. But I think we'll always have a COVID corner, at least until it's all put to sleep. But we also want to have some other conversation topics and teaching. So, and if you have any ideas or topic suggestions, or you think, hey, this would be a great speaker for our town hall to have, just feel free to send Monique an email or a message, because we're always happy to have this. And I would love to talk about something other than COVID, and I'm sure we'd all like to hear something other than that. So that's all I have right now. And with that, I'll turn things back over to Sharon, and thanks everyone, and stay well. You're muted.
So this is Sharon Levine. Dr. Sanchez, you're still here. We have lots of questions about germy kids. So lots of kids are germy, so you do take your chances when you visit with them, and grandchildren are not vaccinated. They go to school, play sports. Still low risk visiting them even overnight?
Yeah, so, the CDC, in thinking through the CDC guidance, what it advises is, and we consider kids unvaccinated and one to be fully vaccinated. And they tell us that indoor visits between fully vaccinated people and unvaccinated people, like our kids who do not wear masks, are likely low risk for the vaccinated people, meaning yourselves, and that the level of precautions should really be determined by the characteristics of those that are unvaccinated and the risk. I think this comes back to what I mentioned earlier, and that it really depends, a lot of this does depend on what matters most to you and your level of comfort and your own comfort with risk. Vaccines are amazingly effective. They're not perfect. And again, their protection will be greater when our kids are also vaccinated. And so I wouldn't think of it as an either or. You can always alternate time indoors unmasked, hug your kids with mask time and outdoor activities. I think that's what me and my family have done. We've taken the sort of liberty for those quick hugs and to, eat dinner together, but, then we still sort of take our precautions in other ways. And so I think, I wouldn't be afraid to sort of, defend your want of, precautions, because I think we're all still at a level where we're still trying to figure out what we feel comfortable with. And I think that the CDC guidance is one piece, and then what where your grandkids are going, who they're seeing, what you feel comfortable with is another piece. I think that's what I would say.
Do you want to comment on, sometimes people have questions about, well, should we get COVID tested before we're going to get together?
That's an excellent question. I think that, truthfully, I think that we still should use sort of the tools at our disposal, and testing is definitely one of them. And so, for example, if your grandkids wanted, if people wanted to get tested before getting together, I think all of those are layers that will sort of work to lower our risk of getting infected. And so that's certainly another alternative. If your grandkids want to be tested, if everyone wants to be tested, to feel a little bit better about it. So, that's one thing that we're trying to sort of remind people, is that we still have other tools that we can keep using, and that we should be using.
There's a question
especially
about
amongst
boosters.
Unvaccinated.
Question about boosters. I'm sure this is going to start to turn into like the annual flu vaccine or something like that. These are pretty smart viruses.
Yeah, no, I mean, I think we're still, again, one of the things that we still don't know is how long immunity lasts. Recently, there's been studies that suggest, that it might last up to 8 months longer. I do envision that this might be sort of a booster shot annual situation, but we'll find out. Still TBD.
Let's see, we have any other questions here? Yes, we have. Dr. Sanchez, even CNN has the same problem with people coming in and out and sounding like they're inside a tuna fish
I
can.
apologize.
It's all right. It's mostly
I think
okay.
it might have been my internet.
Every time it happens
Okay.
on CNN, I feel vindicated. Or even Judy Woodruff. So I don't think I see any more questions. One thing we would love to have is input from you about town hall topics for town halls. We would love to address the things that are important to you and that are interesting to you, COVID related or not COVID related. I think all of those, anything is game, and we would be fun for us, as Dr. Russell said, to talk about things besides COVID. We can always give you the updates as they come along, especially as J&J is coming along, what decisions are being made. People, just to tell you a couple of things, is that people are invited at MGH to get vaccinated, and there are 4 million people in the system, so they're doing everybody as fast as they can, and they try everything. They try gateway, they try telephones, they try cell phones. They will send snail mail if they haven't heard from people. So if anybody knows anybody who's asking, I didn't get an invitation, they are coming. I would say most people in the age group of the patients that we serve on this call are getting their invitations. But as you know, there are many places in the state to still get vaccinated, and CVS and other places. So it's not only here, but I hope you invite your friends and talk to them about how important it is to get vaccinated if they haven't been. I think the more of us that gets vaccinated, the better it is for the country and things getting back to normal. And anybody like Dr. Sanchez who's into public health, that's one of the best things that we can do. But any suggestions for any public health topics just would be great. And we would love to talk about that.
Two more questions there, Sharon.
So is there any discussion about someone who's received the vaccine and feeling more tired than 1 month after being vaccinated?
That's a great question. Fatigue has been quite a common symptom as it pertains to the first few days after vaccination, and especially after second doses. I think that has been, pretty commonly reported. I haven't it does seem like, so I hadn't heard about that. It came up as a question to this town hall, and it certainly hadn't come up in some of the community, work that I do, but not sure if it's come up amongst patients in your practice.
Yes, they have. We've had patients and family members who've talked about being fatigued. Usually goes away. It might take a week or two or a couple. I think I will tell you, I honestly, after my second shot, I felt really tired. I'm not someone who gets tired easily, but I felt really tired for a week or two after my second injection. So I think that when patients tell me that, I don't know if it's caused by something else. We don't know, but it's possible.
Yeah, I don't. Yeah. And then the younger kids being able to be vaccinated, Pfizer did recently request approval for, and that's being reviewed by the FDA for kids 12 to 15. And more of the pharmaceutical companies have also started trialing in even younger kids. And so I think that is very exciting. And so hopefully, this will be forthcoming.
Great. If anybody has any ideas for upcoming town halls, you can put them in the chat. Any kinds of topics, even if you know speakers who are interested in talking about certain things, we would love to get some feedback, and we certainly would love for you if you have interest in our group classes, and we really look forward to seeing everybody back in person as much as we can, although we're still, you know, we're all still sort of looking like this in clinic. It's never more than a few feet away. Those of you who know me know that. We keep them close at hand.
Sharon, I'll share with people that the Dementia Care Collaborative is doing health and resiliency programs, and they are for anybody. So it is not just for people living with dementia or their caregivers. That has always been the focus, but now they are open to everybody in the community. So please check our website on MGH in the Division of Palliative Care and Geriatrics, or you can go to the Dementia Care Collaborative. We try to send you all the emails, including also, but we have a variety of speakers. Today we had music and joy and reducing stress through that. We have an upcoming one on our health and resiliency program that we'd love you to join, about self-massage, Tai Chi, an exercise program. So just a lot of experiential type things that you are very welcome, and all of your family, no matter where they live in the country, are welcome to that. So I would say that. Matt, did you have something about the Blum Center you wanted to share also?
I don't have a different screen, so I can't toggle. So if you give me 1 second, I feel like I need to tell you to do this. Just give me 1 second to draw it up.
He's drawing it up.
And Judy, I think it would be great if since we have time, if you shared your screen before the end of this and showed people the website for the Dementia Care Collaborative, because it's so pretty.
Any suggestions for mask alternatives? Because with hearing aids and glasses.
There are some doohickeys that abound, and it's more trial and error. So there are some things that can brace the mask so it's not rubbing on the bridge of your nose, but you do need to have your nose covered, so you don't want it to be like this. There are also ear adapters. What we do in the hospital is we do a cross stitch. So we rotate. I feel like I'm a flight attendant. We rotate it like this and put it around our ear. And in the event that we lose cabin pressure, an oxygen mask will drop down.
You guys, you can also, if you look, they not only have ones that hook behind your ears, but there are ones that go, you put it over your neck. I have one, and it goes here, it comes up, and then the upper string goes up to your head. So it doesn't even touch your ears. So look for that design also. There are lots of designs online. So, and yes, the recording will be available. Sorry, Sharon.
Yes, the recording will be available. And yes, if you wear hearing aids, be really careful. I have had patients who have lost hearing aids, which is, as you know, is not an inexpensive proposition, by pulling off their mask. So definitely you make any adaptations that you need. We had suggestions for future topics about circulation with aging and kidney disease and those getting older. And Dr. Paul Lamb's Tai Chi, is that on YouTube? I think Tai Chi is wonderful. And I have worked in the South End before, and I will tell you that the Chinese community, a lot of the older people go out there and do group Tai Chi in the park every morning. And it is one of the joyous sights to see in Boston. So I think Tai Chi is great. It's been studied in falls prevention and works. It improves balance, it improves strength, and it's a martial art. So you could tell somebody you're practicing a martial art. And yes, yoga is also wonderful to keep you limber in everything that would need an oil can if you didn't do it.
We have another health and resiliency program called Ageless Grace, and it is a chair exercise, but challenging. and it helps with neuroplasticity. So it connects, I guess my dog agrees, it connects your brain and produces new pathways. So that is on Tuesdays and Fridays every morning. I'll put my information in there also, but you can email Monique, and she put some information about Ageless Grace in there. This gives us a moment to tell you so much more of what we are offering to people. So this is a lovely moment to be able to share with everybody. Other people have questions? Sharon, I'll pass it back to you.
Let me see if there's anything. I think we've gotten.
You did want me to speak about the Blum Center. The Blum Center, our staff are ready, reliable, and ready to help. It's an informal place for people to get practical and accurate healthcare information. It's specialized health and wellness resources. Also has online education programs presented by Mass General experts. It is confidential and personalized to help meet your needs. And the hours are Monday through Friday, 9 to 4:30. And I will put the, yes, I will put the link to the website. It's massgeneral.org/Blum, BLUM-center.
Is
Yes.
it open now?
It
That's
is
the
open
question.
now.
Okay. And this is being recorded, just to remind people so that we have it for the future. Any other last minute questions? These are wonderful suggestions that you're giving us for future topics for either this, other town halls, or, you know, as part of our, you know, our efforts to reach out to people in general and bring them in. We love seeing you. We love having you come to clinic. We love bumping elbows with you. I'm dying to give people hugs, but I'm still waiting and just going with my elbow. So we have a little ways left to go, but it's getting better every day. Let's see, do I see 2 more questions? Oh my goodness. Oh, there, that's okay. Well, I think we've drawn to a close. We've exhausted all the questions. Save them up for next time. And we really look forward to seeing you. If you're not Patients in Senior Health, you can ask a lot of questions to your own physicians wherever you get your care. And we hope if you're a snowbird that you're going to come back soon so we can get to see you too. We had all my patients yesterday on Tuesday in clinic where all came into clinic. It was great. And it's great to see people. Some people have gained the COVID-15. Some have lost the COVID-15. Some have stayed the same. So we're all living through this together. It's great to see you all. And we'll see you again soon. And I want to thank Dr. Sharon Sanchez, wish her congratulations on her new position. And thank Dr. Russell for coming here, and for Monique and Judy helping us get through. And poor Susan Edgman-Levitan, who just was had trouble with her microphone today. But as I said, if it happens to CNN, we get to have a bye once in a while. Okay. All right. Take care, everybody.
Bye,
Good to
everyone.
see you.